Welcome back to 10-Minute Mood. My name is Aspasia and I am one of the psychologists at Sydney City Psychology. The following conversation is between clinical psychologist Veena Sothieson and Dr Eric, a general practitioner with a special interest in metabolism and weight management. He also runs the website Gain Momentum for Life, which is rich with resources for simple, practical and sustainable weight management and eating. Dr. Eric recorded this conversation to let his patients know about an emotional eating group that we are running online this year over 10 weeks. Details about the group are in the description if you're interested, as well as Dr. Eric's website. However, the conversation itself touches on many important aspects of emotional or impulsive eating and taking a different approach to weight management, to eating, and to our body. I hope you enjoy.
Do you find yourself eating out of stress, anxiety, boredom, or you just don't know what you're doing it, but you still do it? Identifying as an emotional eater can be a clue that there's something else going on, and it flags an underlying issue. It doesn't mean disordered eating necessarily, and many people do it. It's completely human to do it. Today I'm joined by Veena Sothieson and Aspasia Karageorge from Sydney City Psychology. Both are experienced psychologists and they've got an interest in disordered eating and body image concerns. Their team have developed an emotional eating group, and I'm super excited about this because I've been wanting to refer many of my patients to something like this. Welcome, ladies. Thank you for joining me.
Hi, Eric.
Hello, Veena. Thank you for joining. Tell us a bit about yourself and about your new emotional eating course.
I'm currently working at Sydney City Psychology. I have an interest in disordered eating or problematic eating and helping clients with that. We're actually looking at running the 10-week online group. It's for adults who struggle with emotional eating, and the online format means that it's just readily accessible for people who do want to join. And what we're trying to focus on is helping people sort of shift their relationship with problematic eating and the way that they sort of relate to their bodies and to food. And I think you may be aware, Eric, that many of us, we just experience certain positive or negative emotions. And then when we do that, sometimes we turn to food as a way to kind of cope with, or maybe we've had habits that have meant that we turn to food when we have those emotions. And so what the group is going to focus on is trying to sort of help you change the way that you use food in your life and trying to find kind of important and meaningful ways to engage fully in your life without sort of struggling with food and eating in your body. And because what we want you to do is be more energized, more present in your life, more connected to people who are important to you, and just give less power to this emotional eating, body shape, weight and size. And so helping you to deal with sort of internal and external triggers for eating or emotional eating, increasing your awareness about what happens when you emotionally eat, looking at things like, physical hunger rather than emotional hunger, learning to manage urges and cravings, monitoring your appetite, hunger and fullness, and just learning to eat in ways that your body needs, not how your mind needs.
The feedback that I've had from my patients is that you're both fantastic and you're easy to relate to. So in a group setup, I think it's probably going to be for some easier and for some a little bit challenging. And we'll talk about that in a few minutes. And it's good that you've developed it because it's easier, not only because of the setup, but the payment options probably will be cheaper than individual face-to-face. So that facilitates things for patients as well. One of my main questions, which is sometimes difficult to know who fits into these groups, is who would benefit from these sessions? Because there's a big spectrum of people that could benefit from this.
I think, look, if you've got some problematic eating patterns, so for instance, if food and eating tends to dominate a little bit more of your life, maybe you've got a lot of thoughts about food throughout the day, or maybe, you engage in patterns like restricting or not eating in the mornings, and then by the end of the day, you're overeating or binge eating, and this happens sort of repeatedly. What we're looking for is kind of, everyone emotionally eats to some extent, but if it is impacting you, and your ability to function in ways that are healthy, and perhaps it's also impacting your health, it's somewhere in this kind of continuum of not normal eating, but sort of disordered and maladaptive eating.
And so the emphasis is a healthy life and nourishment, and in trying to avoid that dieting cycle that most people get into, that leads on to shame and guilt and loss of self-care and more self-control.
Yeah, suffering. It also often leads to a place where we're no longer living in line with what matters to us. Like, we're no longer living in line with our values. It takes away from our ability to engage in relationships and activities and perhaps even work in our life in a way that's full and meaningful to us.
And so, for those that are addressing a weight management issue, and that's not only specifically emotional eating, they would also benefit from this, because there's many, if not all, of my patients, the ones that are addressing specifically weight management for health reasons. Yeah. There is, like most human beings, an element of emotional eating. And so sometimes it's overwhelming because they've got to address the health component and they don't have time or money for the emotional component. It's not until you focus on the whole that you address the issue, which it starts with trauma, a struggle, a pain that leads onto a distorted coping mechanism that through your group you obviously will address, and you'll give them skills.
Great. You can't just take a set of coping mechanisms away, whether or not they're adaptive or maladaptive. You can't just work to take them away and not replace it with anything else or a new perspective or relationship to these things. So it is very much about also teaching skills and strategies and ways of approaching this topic.
What advice would you give to those that feel embarrassed or ashamed about meeting groups and talking about that again? It's uncomfortable talking about their food attachment, their emotions, and how they relate to food and themselves.
It's oftentimes why it becomes such a private behavior, I think, is the discomfort around approaching it with someone else, talking about it, sharing what's happening honestly for each person.
And like any challenge, it's initially difficult to deal with and difficult to be vulnerable and be comfortable with feeling vulnerable.
I think the only way that we can work through shame, essentially, is if we are willing to be open about it and share some of the stuff that is deep down, some of the things that we hold on to. And when we do that, we might actually realize that because we're all human, we're not too dissimilar in terms of the kinds of thoughts and feelings we experience. And I think being part of a group can help us sort of, connect to other people in that way. And maybe that will also be a step in that direction to kind of motivate towards change. And that, okay, so I'm not the only one going through this, and I can also talk a little bit about it, and I can hear what other people have to say. And then maybe that's actually going to help me a little bit with opening up to other people in my life as well, if that's really hard for me to do, to get help.
I was listening to Gabor Mate, and he did a talk on emotional eating. I don't know if you've heard of him.
Oh, yeah, I have heard of him. Yes.
He talks a little about trauma and the link towards everything in life. And so he says that the only way into mastering life is resolving pain and trauma. And so I think this that you're doing leads towards self-care and addressing those issues. So people that probably end up joining you for the emotional eating component will understand that there is more that needs to be dealt with, and they can then channel into talking to you individually and addressing those issues.
Yeah, 100%. I think sometimes this could be like a stepping stone in the direction towards more care and more support, because it is, our 10 weeks at a group is hopefully going to touch on many aspects. But I think in order to change anything significantly and maintain things consistently over time, it's going to require a consistent effort, and it's going to go beyond 6-12 months, essentially. Yeah.
What psychology treatments are used, and what do they mean?
You might have heard of cognitive behavioral therapy, or CBT. That's actually the evidence-based treatment for eating disorders at the moment. However, there is what we call a third wave CBT, which is a kind of newer CBT called acceptance and commitment therapy, or ACT for short. And ACT is actually looking quite promising in terms of the preliminary research that they've done around body image and eating, problematic eating, things like that. The reason that the program was developed with the framework of ACT is because it promotes flexibility, meaning that a lot of times we tend to get very rigid and inflexible about the way that we relate to ourselves and to food and other things that we're doing in life. And so ACT is essentially about acting, like allowing yourself to maybe sort of detach from thoughts and feelings that might get in the way of caring for yourself, in terms of getting in the way of committing to taking meaningful action in your life. And, it allows you to sort of get into the present moment more. So there's skills and strategies around that help you to connect more to what matters to you, even though you may feel ashamed or anxious or afraid, stressed, all of those emotions.
Do you also work on self-compassion and mindfulness practices within the ACT and CBT outline?
Yeah, definitely. We will be doing a lot of kind of mindful awareness sort of practices, particularly around thoughts, feelings, but also like your body, around like eating, food and eating, noticing urges, noticing cravings. And so sometimes when we're not really aware, after many, many years of doing the same thing, automatic habits, and we're not actually aware of what's going on for us. So sometimes we also need to kind of take a pause and just open up to what's happening so that we can actually know what to do next. The self-compassion piece is also particularly important around shame or body shame. So we will be looking at how do we actually care for ourselves and take a different way of approaching and treating ourselves and our bodies, because our bodies are what we have. We may not like them. We may not come to terms with them or accept how they are right now, but it doesn't mean we can't treat our bodies in ways that are nurturing and nourishing, especially if they allow us to do things in our lives that are important. Like, for instance, maybe to play with our kids or to help us travel or to get to work and get to home and get to places that are important, go for walks, those kinds of things. So we do need to relate to ourselves and our bodies differently, even though we may not like them as they are right now.
It looks promising. So I think let's reject that diet mentality. Let's work on the emotional distress, the guilt and the shame, and let's use food as nourishment and not necessarily as a coping strategy. Any last words on encouragement or inviting people over to your groups?
Yeah, I mean, the worst thing is that you try, right? In that, you give it a go. The main thing is that you show up, that, you are willing to kind of listen, to participate, see what happens. Otherwise, you won't know, right?
I was just going to add too, I think it's important to remember that you're still very much in control if you take part in this group. You're still very much in control of what you do and don't share. And that might be a journey for yourself along the way. You may start off very quiet. You may choose not to share much. And you may challenge yourself along the way just to open up a little more. Take your time with it. Be patient with yourself through it. It's really seeing this as a step-by-step process. Rather than seeing it as the whole 10 weeks. So that's the end of the conversation between Veena, Dr. Eric and myself. I hope it was enjoyable and you took a new perspective from it around eating, weight management and your body. If you're interested in the group, you can get in touch with us at Sydney City Psychology, either through our website or giving us a call. If you're interested in learning more about Dr. Eric and his approach and his resources, the website Gain Momentum for Life is linked in the description. Thank you for joining us over this 10 minutes. And as always, I hope it has been enjoyable and helpful.